We have a class today that I'm excited about. It's a class that I have been wanting to have for several months. What I did is I emailed the whole team and I asked them to send me back the most commonly asked questions that we get on our end that are kind of medical related. And then I sent them on to Dr. Duran and she was able to review them. And it's our Ask the Doctor question. You'll see at the last slide, we are going to try and have a class similar to this about every 10 weeks where we get a provider that comes up and answers questions that you guys have. So this is Dr. Duran. She sees patients in Mount Zion for PCW and has been on the team for about 4 or 5 years. We were trying to figure that out the other day. And so we're excited to have her here, and I'll let her get started with question number 1. Why is constipation so common on this program, and how can I offset it?
Yep. So constipation is something that a lot of people come with even before they start the program. Why? Because our food, our eating habits are so terrible. That's the reality. So one thing that you're going to go through when you start during the program is a ketosis process. And a lot of people fear ketosis and they don't understand, why is it dangerous or if it's even dangerous at all. And I like to say ketosis is physiologic. Your body is meant to do it, is meant to have it. It's basically kind of a plan B or another source of energy when we are deprived of carbohydrates. Carbohydrates, think about as fuel, is what we, the body, use easy, quickly for fuel. So when you eat, the larger percentage of food is based on carbohydrate. It transforms or it degrades into sugar or glucose, and that's rapidly utilized by the cell. It's kind of the fuel, the gas that we need in order to run our bodies. Well, think about when you don't provide the body with enough of glucose, your body needs energy. So we have another process all built in within the body called ketosis, where your liver, in situations where there's not a lot of carbohydrate, your liver can produce another source of energy or another source of fuel, which is called ketones. Ketones is what triggers the ketosis process. So it is not dangerous, it is a physiologic process. And one of the things that we notice as you enter that ketosis process is changing in your digestive system. Not only constipation, but also diarrhea. Those are the two more common changes that you might experience. They're not dangerous. There's something is usually very temporarily as you establish your new eating habits, they usually go away. What can you do as part of preventing it? Nobody likes to be constipated. We don't want you to be constipated. And the number one thing that you can do to prevent it or even to treat it, if you get there, is by drinking water. Drinking water is gonna provide all the volume that your body needs to run at its best, not just for your digestive system, for everything in general. So water intake, and I tell my patients, half your body weight should be the amount of ounces that you should be taking every day. So we all know the numbers, so calculate half of that, what you currently weigh, should be how many ounces. If you stick to that number and aim for that number every day, chances are that you're not gonna even get to be constipated, or even if you are, it's going to be resolved. Another thing is movement. If you sit all day, if you really have no movement, I'm not saying hit the gym hard, just say move around, be active, walk around, do something to keep your body moving. That's gonna allow your digestive system to work at its best. I encourage a little exercise. This is something that requires no money, no time, and it's so simple. If you have the habit of in the morning, as soon as you wake up, drink a glass of water and sit on the toilet for about a couple of minutes, not like you're pushing, not like you have to have a bowel movement, but if you do that exercise, you're creating connections between your brain and your sphincter. So you're connecting, you're creating a sense of, that process to happen. So do that. It might take several days, several weeks, but it's a good habit to do. So first thing in the morning, a glass of water, sitting on the toilet for a few minutes is creating brain bowel connection. It allows for, have a bowel movement. Ideally, you should have a bowel movement every morning before you hit the door and a busy day at work. You should have a normal, soft bowel movement, okay? By water, you will prevent a lot of these.
All right. Question number 2, she's already started to discuss a little bit more information, Dr. Duran, on why does the PCW team bug you guys so much about water, and is it really that important?
Super. Think about 60% of our bodies is water. So the main component of our bodies is water. So you need to have, for all the body functions, we need water. So, and we have adjusted running our bodies without enough water. We know we can do it. Is it healthy? Not. Even Becky mentioned, even for your blood drawn, you want to have water. You don't want to be sick multiple times. So allowing, this amount of water, half your body weight should be the amount of ounces a day, is going to prevent the digestive problems, but it's also it's going to help with your weight loss process, okay?
All right, question number 3. How much weight do I need to lose to see health improvements, and which are the first health improvements I should see?
Well, think about the majority of our people here, not only, they deal with being overweight, but it also deal with all the illnesses. And the majority of these illnesses are weight related. We have something called BMI, body mass index. It's a ratio between your height and your weight, and it's different for all of us. We can't change the weight much, but we have a lot to do in terms of weight. So if you think about, the correlation between body mass index and different illnesses, your chances or your risk of developing metabolic illnesses like diabetes, high blood pressure, heart disease, even some cancers, which are the predominant illnesses that we see, every day. Think about what's the number one killing in America is heart disease for men and women. That's a reality. And smoking has reduced, and we still have the number one killing illness is heart disease. So what do you need to do? Lose weight. That's basically the next step. So by reducing or going into that normal body mass index, which is 18 to 25, and of course, we all come from a very large number. I don't expect you to be between 18 to 25, but if you can be in the 20s, in the mid or high 20s, that's a huge improvement. A lot of people come in the 40s or 50s body mass index. So just by reducing the number, you're reducing chances of becoming diabetic. You're reducing chances of developing heart disease or developing cancers by huge percentage. So please consider that. When do you gonna start seeing your first health improvement? You will see a lot of people tell me I have more energy just by losing a few pounds. You're gonna feel, of course, you're carrying less weight. So more energy, better sleep. A lot of people feel even more mental clarity, which is exciting, and we just want you to be there, right? I would say I don't get too fixated in a number. When I meet with all of you, one of my questions is, what is your goal? What do you want to accomplish with these? Not only in terms of your weight that you want to lose, but also what are your health goals? Maybe it's just come off of medicine. Maybe not having to see the doctor every 3 months. Maybe not having to stick insulin every single day. Things like that. So we really want you to get there, and we are seeing these improvements as you lose weight.
All right, question 4. Which medications can I expect to get off
Yes.
of? How quickly?
And I'm a big fan of getting people off medicine because as a society, we have a huge polypharmacy. The average 60-year-old in America is already in 5 prescription medications. Is that common? No. Are we used to it? Yes. So think about what are the most common medications that people, middle age take. Blood pressure medicine, diabetic medicine, thyroid medicine, painkillers, depression medicine, antidepressants, sleeping aids. Those are the things that millions of people are taking every day. Do you really need them? The answer is no. What's the foundation of that? is usually weight. As soon as you start losing weight, you don't need so much diabetic medicine. Your blood pressure is naturally is gonna lower just by being less heavy. So you might be able to, and we do that all the time. How many of you have taken blood pressure medicine or diabetes medicine? So, sleeping aids, that's another important thing. Think about the side effects of so many of these medicine. One of the most common side effects is what? Anybody knows?
Weight gain.
Weight gain, exactly. So I want you off the antidepressant. I want you off the anxiety pill. I want you off the sleeping medication or the diabetics. So, and people get excited when you start taking less. So those are the things that I will encourage you to consider and plan for it. If we have that as a goal, we can get there, and we do it all the time. Okay.
And we do as a team, we get really excited. We like to see you guys lose weight and reach weight loss goals too, but we really feel a good sense of accomplishment when we help you guys get off of some of these meds. Some of you have been on these medications for 10, 20 years. So,
Yes.
And that's really, we're medical weight loss, but we're also chronic disease management, and that's what sets us apart, from a lot of different programs. So. All right, and Dr. Duran started to touch base on this next question. I'll let her elaborate a little bit more. Why is ketosis potentially dangerous, and when do I know I'm in ketosis?
Well, it's potentially dangerous if you don't do it right. And, as I said, it's a physiologic process. Your body has the ability to utilize ketosis process as a way of fueling our bodies and giving it energy without the use of carbohydrates. It's kind of a secondary option. Well, you want to provide what that secondary option needs. The number one ingredient is water. That's what we bug you about, water all the time. If you maintain, a good water intake and you stay plugged in with our classes and you learn and you get educated and you have your goals and your everybody in the team connected with and you follow, you will not have any complication. We've been doing this for years. I have not ever taken a patient out of the program because of complications or because of the ketosis was harmful for that particular person. So ketosis is very natural. It will happen in a good way for you if you follow it if you follow our recommendations. Stick to I will tell you, a lot of people get excited, started the program, and they do it really well, and then guess what? Life gets in the way, birthday party on the weekend or something, and then they start eating again. When you start eating and loading with carbs, guess what? You're telling your body, well, we don't need ketosis because we got so much carbs that we gave you, so now the body gets out of ketosis. So that process of in and out, is not gonna get you anywhere. So start the program, commit to it, do it right, allow your body to adapt. Everybody that has met with me here, I always tell you, you're gonna go through a process of adaptation where your body is going to learn to go from high carb load, where the body produces a lot of glucose and use glucose, and because we had too much, the body does not know what to do, and then we store it. We store it in form of fat in different areas of the body. Well, now you're gonna go through a process that you're gonna be deprived of carbs, and the body's gonna say, well, where do I get my energy? Your liver kicks in and start making, ketones, which is the process of ketosis. So if you wanna be effective in that, don't start in and out. Stick to the program, follow it. It's designed. I tell all my patients, everything that you're getting from the program is allowing you for all your body functions. Whatever you do every day is allowing you don't need any extra. And that is very well designed to go through the ketosis process in a very natural way without having to deal with any complications. So in general, very, very effective. I'm not concerned. If you follow it right, it's not dangerous at all. And how do you know you're in ketosis? Well, it's different for every person because, we have an individual body. So one of the things that you will see, number one, is you're going to lose weight. And that gets exciting, right? People like that. Number two, you might notice a change in your taste or your breath. You might feel, a lot of people describe it as a fruity breath or even bad breath or metal taste. It's usually temporarily, it's usually no harm. It's usually, people don't like it, of course it's inconvenient, but it usually doesn't cause any problems. It usually goes away very quickly. Some of you go through ketosis and don't ever get to experience that, good for you, but it usually is harmless. Another one that we notice is might be a little bit of a tiredness. You might feel a little, drown or tired. Again, it's usually because you're not drinking enough water, or number two, it's just part of it and allow your body to, go through, adapt to that, and it usually goes away. Those are the most common ones. You might experience a little bit of changes in your bowels, either constipation or diarrhea, and we want to know. We definitely want to know. That's why I want you guys to take probiotics. Probiotics is good bacteria that we should have, and we don't. So by taking probiotics, allows your bowels to be, working well, and it also strengthens your immune system. Immune system is 90% in your digestive system, in your intestines. So having healthy guts allows you to be healthy, okay? So, what else? Am I missing
Alright.
something?
Two more, oh, from that question?
From the keto, any questions on that?
Question so far?
Questions on ketosis, how do I know? You might not notice a huge change. A lot of people go through and it's a very easy process. They don't feel any big changes. Sometimes increase of energy, could be a little bit fatigue, but also some others experience a little bit of energy, extra energy. So in general, it's very well tolerated, not a lot of issues, and most people do well. You might notice that your appetite will decrease. And a lot of people think that, well, I've been eating these and now I'm gonna eat these, I'm gonna be hungry. Well, usually when you get through ketosis, you don't experience hunger because again, you need less insulin. The key is the insulin. What makes you hungry is insulin, right? And then when you have ketosis, you don't need to deal with so much insulin. So your insulin production naturally lowers, therefore you need less. Therefore you're not hungry.
Okay, two more questions. This one, why do I need biweekly labs and what are you looking for?
Well, think about it. We want to make sure that all of you can go through this program safely. We want to know, that's why I meet with you and ask you what are your medical history, what diseases have you dealt with before, because we need to know. We need to make sure that your body is strong enough. You have a strong and healthy liver, you have a strong and healthy kidneys that can deal with all these processes in natural way and not deal with any complications. So think about what are the things that I look for in your labs. I look at your liver function. We call them LFTs, or your liver enzymes. We look at your kidney function, how your kidneys are filtrating, because now you're gonna detoxify. This is a very natural detoxification process where you're gonna be eliminating toxins. Well, you eliminate toxins through your kidneys. So we wanna make sure your kidneys stay healthy, okay? So we look for uric acid. Uric acid is a byproduct of metabolism of protein. So we wanna make sure that you can process protein in a good way, that you don't build up uric acid, since uric acid could, if it increase, it could increase its chances of developing, kidney stones, gouty arthritis. Of course, we don't want you to go through any of that. So that's what we're looking for, and that's what we monitor every 2 weeks, because we want to make sure everything is smooth and good working for you.
Okay, and our last question, just to introduce this question, the Dr. Duran speaks about it very well. At PCW, we have our nutritional supplements. Sometimes people get hung up on the fact that on the very low calorie plan, they think it's a liquid fast that you are doing. The nutritional supplements that we use to replace your nutrition, there's nothing magical in it other than it's very nutritionally solid with vitamins and minerals. It's a tool. It's a tool to help you replace your food while we're working on lifestyle changes. And that's what we do, is we try and provide tools to help you along this journey. And we have found another tool that works very well and we're excited about. And I don't even know how to explain it. That's why Dr. Duran is here. And she understands it very well and how it works in our system and how to help you understand it better. And so this is our last question. Can you explain the UltraCell product that we are providing for the PCW people?
So UltraCell is what I have here. It's a full spectrum hemp CBD oil. So it's rich of cannabinoids. It's what I consider kind of a mega multivitamin, okay? In this supplement, by the way, this is a dietary supplement. It's not a prescription. You don't need a doctor's permission. It's not mandatory. It's not like you have to take it in order to be in the program. It's an option. We want to give you several options. I'm a big fan because I'm seeing so many good results with these, not only here, but in my regular practice. And I want all my patients to learn and consider it, because what you're getting here is the supplements that we should be getting in our food, and we're so deprived. So we're getting over 400 compounds or nutrients, not only cannabinoids that are essential for our well-being. And this is something that a lot of people don't know, because it's a recent medical discovery. I know the word cannabinoid raises eyebrows and people are like, what is she talking about? This is extremely important. Cannabinoids is part of our health. We make them, the body makes them, and we are not making it enough. So using the plant-based cannabinoids, which is coming from the hemp plant, allows the body to put them, to put them in the right places. What we are seeing is as an appetite suppressant. It shuts down your appetite, right? It works in your brain, in satiety center, in your satiety center, to reduce anxiety, to calm you. It affects in a very good way your mood. It allows for better sleep, increases energy. Is also an anti-inflammatory. Actually, CBD is 20 times stronger than the regular anti-inflammatory. For example, your Advil, your ibuprofen, those things. We're not fan of those. If you're taking ibuprofen every single day, several times a day, that's dangerous. Please don't. That's dangerous. You're tearing the lining of your stomach and causing other problems. So consider these 20 times stronger than regular anti-inflammatories, 6 times stronger than steroidals anti-inflammatory. And somebody asked, what are the side effects? None. Because this is something that your body should be making. So your body relays very well. No side effects. Super well tolerated. No interactions with any medication. A lot of people can benefit. So we want you guys to consider a supplement like this in addition to what you're doing with PCW. Is it mandatory? Of course not. It's an addition to, it's a tool. You're gonna feel more energy. You're gonna go through that ketosis in an easier way because it's allowing your body to be content and be happy with the amount of food without having cravings, without having, hunger pains and things like that. Increases your ability to sleep better, increases your ability to deal with stress, and then lower your anxiety level. And if you're dealing with achiness or pain, any source of pain, very, very strong. So we also recently added another product that I'm passing flyers. We don't have it here yet. We should be getting it in within this week. It's called Ultra Burn. It's kind of the brother of these. This is called Ultra Ice. The other one is called Ultra Burn. Ultra Burn is also an endocannabinoid support. It stimulates your endocannabinoids, but specifically for weight loss. So it's a weight loss additive. It's a weight loss in addition to your weight loss process. What it does is, going back to insulin, it allows your insulin to be more effective. It increases the chances of your insulin working better for you. Okay? It contains, the main ingredient is called chromium picolinate. You don't have to know that, but chromium picolinate is notorious for increasing the performance of your insulin. So you don't need so much insulin. Okay? Therefore, it shuts down your appetite, therefore allows you to control portions, to be content with less portion. People that are trying to do, portion control allows that as well. How do we take it? So Ultracell, once a day, is a sublingual supplement. So it's a liquid, you're gonna see it is a bottle. Shake it, put 1 dropper full under your tongue, and you leave it there for a minute, because sublingual is the best absorption. Sublingual, it doesn't have to go through your entire digestive tract. It goes straight to your bloodstream, okay? So it absorbs very quickly and very well. So sublingually, you leave it there for 1 minute, and then you swallow. It's gonna be mixed with saliva, then you swallow. Ultra burn is ultra cell every day. You can take it morning or you can take it evening. If you don't sleep well, take it in the evening, right before you go to bed, okay? Play with it. I mean, there's no really, one dose fits all, or it has to be taken at the same time. It's okay, even if you accidentally drink the whole bottle, you're not gonna cause any harm. You're just gonna waste it, but you're not gonna cause any harm. So consider evening or morning, play with it. If you guys have a different work schedule, find out when is the best time for you to take it. Take it once a day, I would say, and let us know. If you have questions, let us know. The Ultra Burn, I would say no more than 3 times a day, and you want to take it always before a meal. Same thing. You put a full dropper under your tongue. A dropper is about 1 ml, 1 milliliter. You put 1 dropper full under your tongue. You leave it for a minute. Again, we're allowing fast absorption, fast and direct absorption into the bloodstream without having to go through the stomach and all that, okay? No more than 3 times a day, the Ultra Burn. Okay? Questions?
And then you pass flyers out,
Yes,
that will help. So.
yes.
Okay, so let me go over the last slide, and then Dr. Duran can answer questions that you have. Again, about every 10 weeks, I'm gonna ask a provider to do a class like this. So if you have questions that you want one of the providers to discuss, please let the team know. We'll put it in our next class. Dr. Kroll is our physician down in Effingham, Dr. Duran and Jackie are in Mount Zion, and then Dr. Wu is our doctor out here. So I'm very excited to have you come this morning. Thank you.
Thank you.
And everybody, have a great week.